Hi, my name is Janine and I'm a social worker and counseling therapist with eClinic United, and it's a privilege to share with you today. In my work with motor vehicle accident clients, I am guided by values that are absolutely essential for effective counseling. These include extending unconditional positive regard, sincerity, empathy, and respect for client input. These values help to create and establish strong therapeutic relationships and working alliances to help clients freely express how they're thinking, feeling, and behaving, allowing them to develop insight and decisions for change. To this end, our counselors come alongside our clients with evidence-based interventions that are customized to their personalities, needs, and goals. We always make sure to meet clients where they're at and to move at their pace, honoring them as the experts in their lives.
Hello, my name is Lolita Abramian and I'm a registered psychotherapist here at eClinic United Healing. As Janine mentioned, our bond with clients is crucial to our work. We provide holistic psychological services to honor our patients and their families through our unique programs. We do this using one-on-one coaching sessions, couples therapy, and group counseling. And we use approaches such as CBT, cognitive behavioral therapy, DBT, dialectical behavioral therapy, EMDR, eye movement desensitization and reprocessing, and many more. We also offer educational webinars to help strengthen our patients' understanding of mental health. We are warm and compassionate, we are effective and understanding, and we strongly uphold the values of confidentiality. Collaborating with other psychotherapists allows us to strengthen our team and provide the utmost care to our patients. We are here for you.
My name is Monica Boulis. I am a rehab support worker at eClinic. A rehab support worker essentially is there to support the client in any way in rehabilitation, supervised by the OT and figuring out tailored goals towards our client. So really sitting with our client, listening to our client and seeing what are some goals that they want to be working on, whether it's, getting back to walking again a little bit, or going back to the gym, or going grocery shopping, or simple things like, taking care of themselves a little bit more. And so that's a little bit about what I do as a rehab support worker.
I recommend helpful tools like supplements, kitchen equipment, and meal plans in order to assist clients in meeting their goals. Together, all these services help fuel my clients in order to provide recovery as well as get them to feel their best selves.
My name is Dustin and I am a yoga therapist for eClinic. I provide yoga therapy as well as strength and conditioning. So I use a wholesome full body approach with this therapy. If somebody comes to me, say with a shoulder injury, I don't just look at the shoulder injury, I look at the imbalances that the injury has created throughout the whole entire body. And then we put emphasis on healing the injury and emphasis on healing the imbalances that have also been created so that their whole body can come back to radiant health and balance again with all the kinetic chains and systems. So the reason why yoga therapy is so powerful and yoga in itself is because it looks at all the systems of the body. It doesn't take a Band-Aid approach. We approach it mind, spirit, body.
My name is Nicole and I manage the yoga and psychology departments here at eClinic United Healing. So when hiring therapists, I always look at compassion, adaptability, dependability. I think it's really important that our therapists have the ability to support different clients in different situations and in different moments of their recovery and life. The thing I am most proud of in our yoga department is seeing the progression of our clients from when they begin therapy and through their treatment plans. Really, really amazing and inspiring to me to see the support that the therapists are able to give the clients in helping them with their recovery. And also hearing about the stories of our clients and how they're able to take those tools and things that they've learned during their sessions and apply them to their everyday life to help to improve their quality of life.
A lot of times after an accident, clients just don't care about their eating habits at all, and that affects them both mentally and physically, because a lot of them usually gain or lose weight tremendously. So any client that's kind of suffering in that aspect can really benefit from our nutritional services, because dietitians can't guide them in the right direction. We do offer services on denial. A lot of our clients need these services and they're willing to participate post-denial. So we do offer vitamin supplements, post-denials, meal plans, even counseling sessions. And in my perspective, the best service probably would be meal plans. Every client that has received meal plans has always wanted more and, found it really beneficial.
I really like helping people. It's just part of who I am, and that's really what motivates me. And I think the main thing that keeps me sort of going in this position is seeing my client in the first couple of sessions really just down and not willing to have a session, and then over time trying to figure out those little things that really get through to my client. So whether my client really likes to take a cup of coffee, and so I use that as a way to get to them, to motivate them to go outside, to motivate them to be out in a social setting. And seeing that transformation is really what drives me to keep going.
I knew I wanted to help people from a very young age. And one of my brothers, when I was about 10, was in a really bad motor vehicle accident. And he worked with an occupational therapist who really changed his life. And it directed me in that area of expertise to see how kind of much you can influence one person's life. That was a very big reason why, for sure.
So it is one of my goals as a practitioner to help clients understand and learn evidence-based nutrition and find sustainable and meaningful ways to add this to their specific needs, lifestyles, preferences, and cultures. I really love working as a dietitian with my clients because it allows me to really watch firsthand clients transform themselves both physically and mentally through the power of food. And our choices can really dictate how we're feeling in terms of energy, our mood, digestion, sleep, and so much more. So it really is a pleasure to see all of these areas change when I'm working with clients, and it makes it really exciting to be a registered dietitian with eClinic.
Well, I've seen the power of what yoga and yoga therapy has done for me over the years. I've used it to heal my own injuries and ailments, and I like to share that with other people who really need that service and can come back to their best radiant health. Seeing them overcome their challenges and proving to them that regardless of what kind of an injury or limitation they have, they can always get a better quality of life in the end if they follow the process.
The main challenges for somebody with a brain injury, or personally my clients, is motivation. A lot of these clients, after a brain injury or a motor vehicle accident, they lose touch with their world. They lose their social connection. They lose their family members sometimes. They lose their job. They lose their hobbies. They really lose everything around them. And they just need that attention and that assistance to get back. But those are some of the things that our clients kind of go through.
And helping them kind of schedule and create this balance where they can live and manage with more success. It's definitely not an easy feat. I kind of always tell my clients, and they say it to me, it's like a full-time job, really kind of going through and dealing with that day-to-day struggle. And I agree with that as well. I think it's just finding that right fit is really important. But I think kind of the biggest thing when we look at working with them and then kind of their experiences, sometimes they feel almost stuck, where they don't know where to go, don't know who to talk to, who to turn to. So I think if there was like a message, it's just, check in on the client a little bit sometimes and just really make sure they're doing okay. Even if it's like a minute-long phone call, I know it would mean a lot to them. Sometimes these journeys are long, 4, 5, 6, 7 years, and it can be exhausting.
On top of utilizing evidence-based nutrition while working with my client base, I also like to learn about the whys behind their behavior. This allows us to understand their potential barriers to implementing change and then work together to address those barriers and overcome them through sustainable means. This allows us to really take a multifaceted approach to counseling and see a lot more of that success that we're looking for with our clients.
They really think that they're never going to get better. And so I find one of the most powerful ways to get through to them is relating to them and talking to them through personal example, and constantly really staying on them about doing their homework and doing their routines. And the ones that really stick to it and start to see the tangible results are the ones that come out on top in the end with this type of therapy.
I worked with the case manager whose name is Liana. I got to know her really well because over the course of my treatment, she was with me all the time. She met with me regularly and to review my case so that I understood where I was in the process and understood my needs and how to best help me and guide me along through the process. I was really happy working with Leanne because she knew when I needed physical help, like physical therapy and massage therapy, when my body needed to be healed. And when I later started to develop more severe mental health problems, she was there and she knew what guidance to give me when I needed help with my mental health. And she was with me through the whole process, which was enormously helpful. I knew who I was dealing with. I knew that they knew the process that I was going through and where I had been. Leanna probably gave me the best advice that I had gotten from anyone during the process, and I saw a lot of doctors. When my mental health was really failing, I met with her, as I did regularly, and Leanna said, you know, you need to go to CAMH. And it was a really tough decision to make. I didn't understand that my mental health needs were as complex as they were. But it was the best advice that I had gotten, and I had gotten tremendous help by going to CAMH and getting help there. That was some of the best advice that I had gotten. And Leanna was with me to the end. I discovered that I did have some hidden strengths. One of them was that I gave my self-permission to be more compassionate with myself, that I did have injuries and that it was reasonable to have needs and that I needed help. And Leanna's guidance, I realized that I did have enough strength to get through it, because I wouldn't have gotten through the process without having Leanna's guidance. What really helped me a lot is knowing that I always had Leanna to talk to and that she was going to see me through the process. I wasn't alone, and I wasn't just dealing with someone who was doing their job. I was dealing with someone who cared about me and my health and helped me to understand what I was going through, and that it was okay, and that I, with the right help, that I would heal. But I was definitely, the personalized experience really helped me enormously.
My mental health therapist helped me realize a lot of things and helped me realize that I'm a lot stronger than I thought I was. Mm-hmm. Yes, I'm very grateful to all their help. If your mental health is not good, you can be physically 100%, but you're not. You know what I'm saying? Like, as good as you may feel physically, if your mental health is not there, you're not gonna feel good. Attention, they're very attentive here at eClinic. Very involved, very concerned. They've made this whole transition a lot easier. Anybody who's been in an accident like what I've been, I recommend to be patient, communicate, which is something that eClinic does very well. And just be patient, trust the process, and trust the team that you're with. It's always important to have the right team beside you. Even before I knew what I needed or what I needed for self-care, she was always there, always calling me or messaging me, just letting me know. The connections that I've built with the team, with my yoga instructor, with my mental therapist, is unlike any other. I did not expect such care or such support from total strangers. And the people at eClinic are not just at eClinic to make a paycheck. They're actually interested in our well-being, and they've shown that to me since the beginning.
Get better inside myself and physically, and it is helping a lot for me. And I'm blessed that eClinic came in my life. You know, I was in an accident, but for me, sometimes I think everything happens for a reason. I was working as a dental assistant for so many years. It was very stressful. I love my work, but it was a little bit stressful. They say everything happens for a reason. The accident was really bad. I was just between two cars and I didn't know what to do, what's happening. And it took almost 4 years until eClinic came in my life. Before I was fighting with the insurance, I was having so many issues, all medication I was taking. And for me, eClinic is a blessing for me. Especially this team I have in my life, Justin, Nas, Mary, Katrina, and even Elena is not here anymore, but she was amazing. Even we keep in touch, and that's what I mean. That for money, it's not for money they're working. It's because they work from their soul, and they want to help people. And as I said before, I'm blessed to have them in my life as a person.
Mental health is, for me, it's one of the bigger challenges. It was a barrier to recovery because that was the most challenging part for me, my mental health. During my rehabilitation process, what really helped me was having a person that I can go to from the day one of my accident until the day that my case settled. And that person for me was Lena. She has stood by my side. She was always there to support me. She was able to recommend all the correct treatments that would help me along the way. I've faced a lot of challenges and I'm still going through these challenges during the rehabilitation. There's just physical barriers, there's mental barriers, and it's a long process and a long journey. So it definitely helps to have a person by your side that you can always go to. Throughout this process, I couldn't really find many strengths in myself because I found that it was very hard. Every day you're living this, every day you're going through your, struggles, whether it's mental, whether it's physical. So it was a very dark time for me. It's something that I'm still dealing with. But again, having the support of that one person that I could always go to is what was able to keep me going. I was always able to call, text, reach out, email, and there was always that support that I found with eClinic through Lena. They went above and beyond to help me throughout the process. It was more so other things outside of the clinic's control that were weighing me down, and I was satisfied with how the clinic dealt with everything throughout the process for me. Get us the help that we need. People that are going through this, I think it's important for them to have the right treatments and not have to deal with a lot of denials coming in from the insurance, because that's invalidating and it weighs you down. That's one of the things that I faced. I felt very invalidated during some assessments that were done by the insurance. But again, the clinic was able to help me out with that, help me deal with that, because even when I was fearful that I am being invalidated, Lena was able, and other people in the clinic were able to help me get through that time and deal with it properly. I just wanted to say there was many times throughout this process where there was nights and days that I couldn't sleep because of my anxiety, because of things that I was going through. And if it wasn't for eClinic and the people that are managing eClinic, I really don't know where I would have ended up. So thank you guys for everything.
E-Clinic, I really appreciate them. They really made me to feel some changes. They really managed to advise me on how to have and how to eat properly and to drink the water as well. They have been working hard to help to make sure I'm in the good health. The therapy I get from E-Clinic, it's really changed my mind. Whereby I really had the suicide thoughts. Never had no friends, everybody was just ignoring me. But the E-Clinic provided me some people who came as a friendly, the professionals. They were just helping me to move outside, to go around with people, and they just, like, I have one worker, rehabilitation worker, they just taking me out. Sometimes my mood goes down, and sometimes I can't control myself. I can tell them something, and after some time I come back and tell them, oh, that was not proper, I'm very sorry, and they're really friendly. They understand my situation, and they come on telling me, oh, it's okay, I understand your situation. So I really appreciate that. Hopefully I recover soon from my mental health, and I can see some changes, because I could not go along with people, but now I just wonder how they made me to talk to them. They can come pick me up home, take me to a park, and I can talk to them. And I feel she's just friendly, and she gives me more advice on how to survive. And anything I have the question, I can ask them, and they're really down to help me. The advice to my lawyer, first of all, I'd like to thank them for helping me, and to just send these people the people in need, because some people we're going through problem, and we need the people who are really down to care. Yes, that's a message I can tell to my lawyer. Like E-Clinic, they are really down to help people, and they are really helping. I was in a really hard situation. I was not going through along with people. I was not going along with even my lawyer. They knows I was sending them crazy message. I could not stay with people, but now I can at least trust some people and feel calm. And the things that I have been taught from E-Clinic, I'll make sure I will keep on learning from them, because even the class of meditation and yoga, I forget to mention that before, but yoga and meditation really changed me spiritually, mentally, and physically a little bit, because I felt like yoga really changed, like it calmed me down. And even now, whenever I have some time free, I do my yoga. I follow the step that I get from my teacher, and I thank God I still have this teacher from E-Clinic. She teaches me yoga and meditation, and she always gives me new technique and how to survive, and she's really friendly. And I thank God to make me meet these people, so that I'm really feel like now I can get somewhere, I can really recover with them.
And I think just kind of putting it all together is the biggest thing. And staying motivated and keeping that hope can be a tough thing. And sometimes you will experience even clients who are having a tough time. And it's been a couple of years and they're feeling like it's going nowhere, and you just got to do everything you can and everything in your power. And that's really our role. And I think it's a very valuable role and a very big responsibility as well. But it's something I know that keeps me motivated. It's one thing, it can be the smallest little thing, can make such a huge difference. And I strongly believe that to my core.
Well, some clients may not be able to financially afford the food that would benefit their bodies the best for recovery, and these meal plans can be tailored for their specific injuries, both mentally and physically, to support that recovery. as well as they can be tailored towards a client's specific caloric needs. So if a client does experience emotional eating, for example, these meal plans provide accurate portion sizes for them to ensure that they're on the right track towards their recovery. And lastly, some clients as well don't necessarily have the ability to cook in the way that they might have previously been able to prior to the accident. And these are some easy, quick meals that are healthy and balanced in terms of vitamins, minerals, and macronutrients to ensure that they're still eating while experiencing these injuries.
And what I'm excited about is expanding our ability to support our clients and each other, providing more opportunities for healing, for community and connection.
Because the smallest things can be overlooked and they're the biggest things. Like tiny things can be overlooked, like for example, my client canceling a session. And if I just pick up the phone and say, oh sure, we can schedule next week, then I may have overlooked an entire situation. Well, why are they canceling the session? Are they actually tired? Are they in pain? Or are they getting maybe a little demotivated? And sometimes some of my clients actually need me to pick up and say, well, you know what, I'm actually on my way. So how about we do a 10-minute session and then go from there? And sometimes I actually get to my clients and we do that 10-minute session and we go on for the 3 hours instead of the 10 minutes because they just wanted somebody to be there and smile with them and talk to them instead of just canceling, instead of easily moving the session or rescheduling the session.
Before eClinic, I was very down. Every day, even my husband didn't notice that I was doing something in the kitchen, and suddenly I get frozen. I start to cry like a non-stop. I say, what's happening? Why am I like this? Even I stop all my medications. And I throw everything away because it wasn't me. I was feeling down and medications make me feel more anxiety. Even my family doctor, she's not helping me at all, my family doctor. She gave me some painkillers. She said I supposed to take 3 medications a day. It wasn't working. And I came back after 2 weeks and I told her the medications are not working. Okay, she said, take double the dose, she said to me. Take 6 a day instead for 3. I took 6 a day, I went back. A week after, I said, it's not working. Okay, double the dose. If it doesn't work for 6, take another 3, take 9. I said, I can't do that. I can't do that. And then she responded to me, what do you want me to do? But this is my family doctor, is talking to me like this. With this team I have with eClinic, and it's really helping. There is no medications involved. There is only working to get better.
Globally, nearly 1 billion people live with a mental health condition, making up almost 13% of the population. 1 in 5 Canadians suffers from a mental disorder, which is about 7 million people. At least 20% of them have a co-occurring substance use disorder. The disease burden of mental disorders and substance use in Ontario is 1.5 times higher than all cancers put together, and more than 7 times that of all infectious diseases. In both males and females, depression and anxiety are the 2 most common mental disorders, being among the top 10 leading causes of years lost to disability worldwide. Every year, 12 billion workdays are lost to depression and anxiety. In Ontario, almost 1/3 of those who report a disability are due to mental health or addiction. All over the world, people living with mental health conditions are the subject of deep-rooted stigma and discrimination. Food insecurity increases the risk of mental health conditions in adults. People with severe mental health conditions die 10 to 20 years earlier than the general population. Suicide accounts for 1 in every 100 deaths globally, which is over 700,000 per year, having a ripple effect on families, friends, colleagues, and communities. For every death by suicide, there are more than 20 attempts. More than half of suicides happen before the age of 50 years. In Canada, about 4,000 people die by suicide annually, which is almost 11 suicides a day. Everyone has a right to mental health, and this is what eClinic stands for.